Attention nurses. Want to win some amazing prizes? From scrubs to stethoscopes, shoes, and even cash, Nurse.org has giveaways just for you. Don't miss out. Head to Nurse.org/win to see the latest giveaway and enter now. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hi, friend. Welcome back to Nurse Converse. My name is Mel, a pediatric nurse turned into Nurse.org's Entrepreneur of the Year. And today we are going to be talking about nurses navigating chronic pain at the bedside. Now, this topic hits very close to home for me. And I know that it also hits very close to some of you as well. So I'm very happy to be able to sit and talk to you today about this. In this episode, we are going to look at the prevalence of chronic pain, its impact on the nurse's well-being, and also the strategies for, quote-unquote, managing it. Now, as a nurse living with chronic pain myself, I wanted to take this opportunity to not only share my pain journey, but also I wanted to share the experiences of others in our community because I think it is just so important for us to have a safe space to share our experiences and help others in their journey. We are all in this together, and so big thanks to Nurse.org for allowing us the safe space to talk today. Now, we often think of nurses as the ones helping others manage their pain. But what happens when the nurse is the one in pain? There's this cultural expectation that nurses should just push through and not complain about their own pain. And there's definitely a stigma around asking for help. I know I've struggled with this. I know many nurses who have struggled with this and can definitely attest to this feeling. But I'm here to help break the stigma and start the conversation. And that's exactly what we're going to do right now. I have a fun fact for you. According to the Bureau of Labor Statistics, registered nurses are actually ranked in the top 10 professions at risk for musculoskeletal injuries. We're actually number 6. That's crazy. I mean, I knew that statistic, but just kind of seeing it laid out was kind of crazy. Another fun fact, lower back injuries are the most common musculoskeletal disorder affecting nurses today. It's affecting me, it's affecting a lot of nurses, and something needs to be done about it. Studies actually show that the biggest cause or contributor for this is ultimately stems from us lifting and transferring our patients. Now, sure, yeah, right. Different specialties have higher risk for injury, and I'd like to think that emergency room or a bariatric center would have a higher risk than somebody in a NICU or remote work. I mean, my background is in pediatrics, and you might think, oh, they're just kids. They can't be that heavy, right? Well, you'd think wrong, and all of my fellow peds nurses will tell you that you'd be surprised. On my unit specifically, we saw patients as little as 1 day old and all the way up to 21 years of age. We had a huge population of total care patients. And as we know, total care patients require a lot of heavy lifting and movement required from the professionals. For me, my journey with chronic pain started when I injured myself transferring a patient. And we're going to get to that, but let's just say learn from my mistakes and write the incident report. Okay? A quick little story time. I was working night shift and got a total care patient admission paged up at 2:30 in the morning. And during my initial assessment, I noticed that the patient didn't have a turning or transfer system underneath them. And when I was going in, adding all my orders, I had ordered a system up from the supply and finished my questions. The doctors came in, they did their thing, asked their questions, did their assessment, and by the time that they were done, we still didn't have the system delivered. And I remember looking into the tired eyes of a mother at 3:30 in the morning and thinking, they've been through enough today. They're tired. And I'm going to prioritize patient care here. So I looked at the doctors and I told them, grab a corner of the fitted sheet off of the gurney and that we're going to transfer this patient ourselves so that they can get some sleep and we can go off doing what we need to do. There was one doctor at the head of the bed one at the feet, and I was across the patient. We counted to 3 and each took a corner and transferred the patient from the gurney to the bed using the fitted sheet, which some might count as creative. Nurses, we often have to work with what we got, and at the time, I worked with what I had, which was a fitted sheet that the patient was under. I didn't have to put the patient in any more discomfort than they already were. I didn't have to have the mother wait until it came up from supply. And during the transfer, I heard a pop in my lower back. And it was fine in the moment. I honestly didn't think anything of it. There was no immediate pain, nothing crazy. So I made the mistake and I did not write an incident report. And if you've never written an incident report before, they can be kind of confusing and a little bit lengthy to write up. I remember at the time I had 5 patients. I just admitted my 5th. I was running around like a chicken with my head cut off, admitting this patient, getting everything that they needed, trying to do my 3 a.m. vitals on the rest of my patients, writing my notes, adding to my care plans, trying to talk to the doctors, giving them their updates, giving my charge nurse their updates so they can make assignments, give morning meds, do my blood sugar checks, ordering breakfast for my patients, and ultimately giving report. And I remember that I had to come back that next night and I didn't want to stay late writing the report, so I finished my shift and I clocked out. 2 weeks later, I herniated L4 to L5 and L5 to S1 by putting a pizza in the oven and was off the floor for 5 months. And it's still a crazy statement to say. I remember after it happened, I was stuck in a position for what felt like forever. I was stuck in the bent over position because I was putting the pizza in the oven. I couldn't get back up. It took me a long time to get vertical again. And the pain didn't start immediately. There was probably like a 10-minute delay of, okay, something just happened. And I remember contemplating going to the emergency room when it happened. And ultimately, I decided to not go that night. And I did not sleep at all that night and went in the next afternoon. And ultimately why I decided to go in was because the pain was so bad. Nothing I took over the counter was helping. And I started to lose feeling in my lower extremities. And as a nurse, I know that that is bad. So I went to the emergency room. I got an MRI, and that's where my journey began. I've been very vulnerable about my spine journey, something I've shared a lot about on my social media, because I feel that it's very important for us to share our experiences and help others with their journey, because ultimately it's to remind you that you're not alone in this. I know that it's something that has helped me a lot in my healing and in my journey, is knowing that there was others out there who maybe are struggling with the same things or that genuinely care about me and my well-being. And I know that sharing my journey has helped others navigate their pain. And I'm proud to have the opportunity to be here to share my story with you today. Now, anybody who's navigating chronic pain knows that it is a physical, mental, and emotional journey that often takes a huge toll on us. It can impact our job performance or even the ability to do the job at all. It can affect our relationships, our self-esteem. It can ultimately restrict our mobility to doing daily tasks like doing the dishes, folding laundry, going to the bathroom, showering. Not to mention the implications that it has on our mental health. Studies have shown that people who suffer from chronic pain actually have higher sleep disturbances, increased anxiety and depression, and decreased productivity and motivation. And I'll be the first to tell you that I can attest to all of those things. For me, I really struggled with the new reality that was in front of me. The reality where my husband had to help dress me from the waist down, or that he had to help me go to the bathroom or wash myself. It was incredibly humbling to be in the position where the roles were reversed. Normally, we are the ones taking care of others, not the ones being cared for. And I had a really hard time asking for help. And being that vulnerable was really challenging at first. Not having my body cooperate with me was extremely frustrating. Like, I was 27 and broke my back putting a pizza in the oven. How lame is that? It was a hard reality to wrap my head around. Right when this happened, I had just reached a professional goal of mine, and I was trained to be a charge nurse. I remember ever since I was in nursing school, I always said I was born for the bedside. You can ask any of my nursing school friends, they will say that. And I honestly thought that I would retire at the bedside. I found a job and a population that I loved serving, and the universe played a sick joke and changed my perspective. I was grieving the life that I had, the life that I had pictured for myself. I had to face some harsh realities. Would I be able to have children? Would I be able to run with my children? Would I be able to ever go back to work as a nurse at that job that I loved? Would I be able to find work that would work with me and my accommodations? I had some really dark days, and I had some even darker thoughts. I felt like such a burden, not only to my husband, but to my family, my friends, and my coworkers. But ultimately, I felt like I was letting my patients down. The pain was so consuming and debilitating. It felt like I was underwater a lot. But one thing that I did that helped me get to where I am today, talking to you, is the fact that I kept looking for the bright side. I've searched for the moments of joy and happiness. And sure, yes, I allowed myself to feel, and I definitely went through those woe is me moments. I practiced positivity. I once read this book called The Power of Positive Thinking, and it honestly changed the way that I think and how my brain works and how I perceive everything. And that was something that helped me the most. Keep fighting. I kept looking for the light at the end of the tunnel, and some days that light was brighter than others. Some days it was so dim that I could barely see it. And most importantly, I asked for help when I needed it the most. As nurses, there's often this sense of guilt when we ask for help. And I don't know where this internal battle and pressure to push through the pain mentality comes from. I know there's a stigma around seeking help. I know that there's a stigma around seeking help in the medical field. And there's especially a stigma surrounding mental health in the medical field. I think there's this underlying fear of judgment that sits with us. Like I said before, we are the ones that are supposed to be the caretakers, not the ones that need caring for. If you take anything away from this episode, I really want it to be this, is that asking for help is not a sign of weakness, okay? It's actually a huge sign of strength. I encourage you to advocate for yourself the same way that you would advocate for your patients. Because at the end of the day, friends, we cannot take care of our patients and families without taking care of ourselves first. It's something I've been preaching on my social media for a long time now, is that self-care is healthcare and that we have to take care of ourselves and feed every part of our body, physical, mental, and emotional well-being.
Enjoying this episode? We want to hear from you. Share your feedback and support your favorite host by completing a quick survey, and you'll be entered for a chance to win a $50 Amazon gift card. Head over to Nurse.org/podcast and let us know what you think.
While it is vital to look at the physiological systems that are referring to your chronic pain, we can't forget about the mental health connection there. And navigating chronic pain can be such an isolating journey, but it doesn't have to be. We can all work together to help promote a positive culture of open communication in the workplace. I think that nurse leaders should be actively encouraging their nurses to seek assistance when needed. And I think that they should be providing a clear pathway for doing so. I think that we need to band together and foster a collaborative team approach where nurses feel comfortable relying on their colleagues and not have this fear of judgment for asking for help. I know when I was still working as a nurse in pain, I had work restrictions. I couldn't work more than an 8-hour shift. I couldn't take a certain type of population. Every day was a battle of what I could and couldn't do. So I know how hard it is to feel unsupported, to not feel seen, to not feel heard, or to not even be believed. I know what work culture can do to a nurse. It can either break them or it can help build them up. And part of my platform is helping build those nurses up, because I didn't get the support that I needed, and I came to the internet to get the support that I needed. And now I have the beautiful opportunity to help my nurse friends feel less alone and feel supported and validated in their pain. Because your pain is real. Yes, it's subjective, but it's real. I was off for 5 months before I went back to work. And like I said, I went back with my restrictions. And I know how hard it is to work through the pain and to try to come in with a positive attitude and to smile and to interact and be present with your patients and your families the best that you can when you're struggling or you're hurting. I understand. So if you're a nurse that's working through chronic pain, I encourage you to pace yourself and ultimately delegate tasks when possible. I know delegation is one of the hardest tasks to learn as a nurse, but you don't want to hurt yourself further. It's also very important to learn proper body ergonomics and communicate openly with your peers and management team about your limitations, your pain, and how they can help support you. And if something isn't working, then explore accommodations if necessary. Talk with your physician. Talk with your management team. See if there are any options for you. I know I had a special circumstance where I was working as a PRN nurse when my injury occurred, and I didn't qualify for FMLA with my employer. But it's always worth to have a conversation to see what your options are. Now, once we're clocked out and we're away from work, it's vital to prioritize our self-care. Reflect on our shifts and how we can do better, how we can communicate more openly next time to ensure that you feel supported. Find those moments that just bring you a sense of pure joy and hopefully provide some sense of relief. I know for me, prioritizing my physical therapy exercises and stretches made a huge difference. It was painful and I did not want to do it. And some days I didn't want to. And some days I didn't do it. But after I was done, I always felt a little bit better. Therapeutic massages also worked wonders for my sciatica and muscle spasms. And chiropractic adjustments really helped my compensation issues and realignment. I actually found out that my insurance covers acupuncture, which is pretty exciting. So that's something I'm going to look into. Which brings me to my next point, is being very open and communicating with your insurance and seeing what type of therapies they cover. You'd be surprised. I didn't know about the acupuncture. I also think that hobbies and having a creative expression has really helped me the most in my healing and trying to manage my pain and navigate through it. I think having a project to focus on really helped me kind of focus away from the pain. And it definitely gave me a sense of purpose. It made me feel like I was still doing something. I mean, nurses are notorious busybodies. And after 2 weeks of bed rest, I was losing my mind. I needed to do something. And ultimately, that has what started my business and my little crafty corner and all the fun things that we have done since then. And actually, during this process, I ended up going to therapy, and I've been seeing my therapist on a regular basis now. And this is not me trying to preach talk therapy to you, but I do know that it has helped me a lot in just having a safe space to feel heard and seen and validated in my feelings. And she's also helped change my perception of thinking when it comes to my pain. I trialed different medications. I did occupational therapy. I even tried some wild procedures to manage my pain, including a medial branch block test and dry needling, which, if you're curious what that is, it's basically acupuncture, but with an epidural needle. So imagine an epidural needle going down to your spine, and they just go tap, tap, tap on your bone to create micro injury and trick your brain and body to send red blood cells down to that area so to try and promote healing. Yeah, that was not fun, but ultimately it helped manage my pain. The super fun part about this whole process is that you get to figure it out what works best for you. I'm kidding. It's exhausting. It's not fun. It's a long, tiring, and exhausting process. Because what works for me might not work for you, and vice versa. But I believe that knowledge is power and community is everything. Today, I encourage you to reach out to others who might be dealing with similar challenges to you. Learn from others' experiences and speak your truth. Try to come at it with an open mind and an open heart and open ears. We're all in this together, and it's very important that we lean on each other in times of need. One quote that I want to share with you that just kind of stuck with me was from a TV series, Ted Lasso. The quote is actually a Walt Whitman quote. It's, "Be curious, not judgmental." And I remember watching this episode and that whole scene breaking down, and it has stuck with me and has changed my way of thinking tremendously. In this scene, I'm just going to kind of, no spoilers here, but in the scene, Ted goes up against the, quote, bad guy, and he says that entire life he's been belittled by people, and if only they were curious and asked questions or tried to gain understanding, they would judge. And in that underestimation came a sense of righteousness and empowerment, and it was just beautiful and just something that I wanted to share with you, that being curious and asking questions, especially from somebody who has suffered from chronic pain herself, and as a nurse who helps people manage their pain. Asking questions and trying to gain understanding is huge. And that's just a little side note, Ted Lasso just helped me recover a lot during those times I watched the entire series. And if you like good vibes, just check out that show. But I want to leave with this disclaimer. Remember that chronic pain management requires a multidisciplinary approach. And if you're struggling or you're in pain, please don't wait to seek help from a professional who can address all of the factors, the physical, the psychological, the environmental. All of those things can influence your pain. And if you wait, you can cause more damage. And that's not something we want to do. The first step is always the hardest in asking help, but you got this. Your pain does not define you. You deserve support and deserve to live a fulfilling life despite the challenges. If you ever need a safe space to feel seen and heard, or have any questions about my pain journey, my social DMs are always open. I'm at mels.crafty.corner on TikTok, Instagram, and Facebook. I also have a website, shopmelscraftycorner.com, where you can get cute nurse apparel and stickers to help support you in your mental health journey. I absolutely love connecting with my community, and we've really built a strong foundation for nurses living with chronic pain or nurses who have suffered injury at the workplace. I have an entire spine care journey highlighted on my Instagram page with different resources available in case you're interested. I want to thank Nurse.org for allowing me the safe space to talk to you today. And I also want to thank you for actively listening to my story. If you found today's episode helpful, please rate, review, and share it with a fellow nurse who might need to hear this. If you want to hear more from me, make sure to fill out the survey and mention my name. My name is Mel. I think they might have it as Melanie Van Sistine. That's my full name. But I also want to leave you with a sense of encouragement. I know that every day brings its challenges, and sometimes it's hard to get out of bed in the morning. But every day also brings an opportunity for joy and happiness. So I encourage you to know your worth and your limitations. Don't settle for anything less than what you deserve. You got this, friend. And know that I'm in your corner and sending nothing but good positive energy your way today and every day.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.